Good day, everybody. Welcome to Dr. Tom's Tips Case of the Week. My name is Rolando, and this is Zyrus. Today, Dr. Hirsch is going to show us, check this out, how, with a guided process, he's placing 5 implants in less than 20 minutes. Good morning, Dr. Hirsch. How the heck are you?
Good morning, Rolando. Hey, everybody. How's everybody doing? Welcome to a beautiful, beautiful spring Tuesday morning. It's just fabulous out here, and we're gonna do a fun case today. This is a case I did a couple of years ago on a 55-year-old female, and just going to talk about the surgical procedure and the guided process and how we work with Isolite with our surgical guide, and just kind of the benefits of this whole thing. So. Put these x-rays up. This lady had a 5-unit anterior failing bridge, a lot of resorption on tooth number 6, all the way over to tooth number 10. It was just kind of a mess. So this is just my assistant getting everything ready. We put in our surgical guide. The key to these cases in doing this is the planning in advance. It's not so much the surgical procedure, but it's the planning in advance of this whole thing. We planned this. We planned this on our models. We knew right where the implants were going to go. We knew where the final restorations were going to go. So we knew what the finished product was going to be like before we ever started. So planning is just key in doing this whole situation. The second thing that we do to make this really nice is we have our surgical guide. And one of the nice things that I like about using a surgical guide with the Isolite holds a surgical guide in place on the right-hand side, and sometimes I'll have my finger on the left-hand side over there holding the surgical guide in place. So this is just kind of starting off right now, guided surgery. Really, in the basic mechanics of this, it's a very simple, very easy case. It's we're using a 3.5 millimeter implant, so really, we only have to do 10 osteotomies here. We've got our pilot drill going, and you can just see on this pilot drill just how fast this is going. And what we've done is we'd previously taken out the bridge. We grafted the area. It has some great closure and great healing on this area. And so just kind of going just one right after the other. Don't be afraid to jump into these cases. They're just so much fun to do. And so you can see we just kind of speed this thing up so you're not bored with this whole situation. What you can notice here is with all the water, doing a lot of water in here, my assistant does not have to be in the mouth evacuating and aspirating water. The way that the patient is positioned, the water just going down to the back of the throat, and the Isolite is just sucking up all of the fluid and all of the water, which is really nice. So it just saves time and it lets her concentrate on what she's doing. So really this becomes not only my friend, but my assistant's friend. One of the other things that I want you to notice is look at where my fingers are resting. My fingers actually use the Isolite as a 4th finger resting point as we're putting in these implants. So when I'm doing the osteotomies, my fingers are just right there and I'm resting on it. And these just go in so nice and so straight. I already have figured out my alignment, so I know right where they're going to go. And so we don't have to spend time saying, hey, am I lined up in the right direction? Am I lined up in the XY axis properly? No, I know right where it's going to go. When we go to the Z axis, we know the depth that we need to go. So there we have it. I mean, in about 10 minutes now, we've got those implants in, and now we're just taking off the implant carrier. And you might notice, see, I used a couple of cotton rolls to get her lip up and out of the way. So yeah, don't worry about not using cotton rolls if you need it. Now watch this part. This next part's kind of fun. Take the Isolite out, and I removed the surgical guide. And then we go back in and we're going to set the timing and the torque on these implants.
That's cool.
Yeah, it's just a.
And she looks comfortable. It doesn't,
She's just nice and relaxed. I mean, she wasn't sedated. We didn't have her on any special drugs or medication. She's just a wonderful patient. Yeah, and one of the things that's really nice about this is I'm just assured from a safety standpoint that nothing's going to go down her throat. I mean, you can have the greatest procedure going and everything's just running nice and smooth, and all of a sudden something just comes up to bite you in the rear end. And man, it can come up at any point in time. So here we go. You know, put our cover screws in and down they go to place. You know, and as they say, stuff happens. You'll see this in a moment. Stuff happens right there. You know, it doesn't happen all the time, but, you know, even happening once can ruin your whole day or ruin your week or ruin your year. So you just don't need that. So that was just a nice, you know, maybe we needed to do something a little bit differently here. But sometimes little screws just fall right off the carriers. But these are cases that anybody can do, whether you're just starting out or whether you're an experienced surgeon. Pause right there. I mean, those are just super nicely placed implants, just right there at the crest of the bone. And that's the final result that we did some months later. The implant surgical procedure was super easy. It was nice because the patient was comfortable and we evacuated all the water without any problems. It was a fun case. These are fun ones to do.
So Dr. Hirsch, Dr. Tom, it took you, it looks like about 17, 18 minutes to do the 5 implants without the Isolite or without a guided process. How much would that typically take?
If I had not pre-planned this case and I had not used the surgical guide, it would have taken me, I don't know, you know, it probably would have taken me upwards of an hour to place all 5 of those implants to get them just exactly where I wanted if I didn't have to. Yeah, I know right where I'm going to go. I know right where the bone is. And if I have to guess and I have to lay a flap, it's much more traumatic for the patient. On this particular situation, I was able to do this flapless. I was able to punch right through the tissue. And that way the patient is much happier. There's much less pain and much less swelling. And it's just faster. There's no suturing involved. So doing it guided and doing it flapless in this particular case landed very nicely. All the time can we do it flapless? No, we have to lay flaps a lot. Just this last week, I had to flap something on the lower arch just to get to the crustal bone so I could see it really nice. So without guided surgery, it would have been at least an hour to do this. And without utilizing the Isolite, it probably would have taken me twice as long, maybe 3 times as long. We're not in a race. We're not in a race to get this all done, but certainly we want to get the patient in and out and respect their time as well as our time and as well as our profitability.
Yeah, and also to your point that you've made before, especially during COVID right now, when patients come in, do more in the same amount of time, and Exactly. It looks like you're able to do that.
Exactly. We do all these anyway at the same time, but absolutely, get as much done as you can because patients, as they come to my office, are so reluctant to come in. They're so worried about COVID. This is settling down a bit now, but in this last year, it's been a real challenge getting patients to come in. And so once they're there, they like to get as much done as they possibly can get done.
Awesome. Mm-hmm. Well, first of all, thank you. I love watching your procedures. I love learning about what you're doing. Hey, folks, thank you for joining us during Dr. Tom's Tips Case of the Week. If you like this content, please share it. If you have any questions, please feel free to send them to us. If there are things that you'd like Dr. Tom to see, or if there are situations that you're running into that you'd love to see how he gets around it, please let us know. Dr. Hirsch, Dr. Tom, thank you so much. Really appreciate you coming here. I love working with you. You're fantastic.
Oh, this is fun. Hey, here's another thing, Rolando. Just one last thing. Look how clean the procedure was. I mean, honestly, I was just going back and looking at this thing. I don't think I have a drop of blood on my hands. It's just as clean as can be.
Beautiful, beautiful. Thank you so much. Have a great rest of your week.
Thanks, everybody.
All right. Talk to you later.
Bye-bye.